Gallstone disease negatively affects the work of the digestive system. It develops because of improper nutrition, a malfunction in metabolic processes, or due to some other factors. By the age of 40, many people begin to suffer from gallstones, and so begin to look for different ways to dissolve the stones in the gallbladder and liver. We have gathered all the information about these diseases and the best mainstream and folk methods of their treatment. But before we move on, make sure to subscribe to the channel to watch the new episodes on Big Progress. We're doing our best to create interesting content for you. What is this disease? It's associated with metabolic disorders when calculi form in the gallbladder and hepatic bile ducts. Can they be dissolved? It depends on the stage of the disease. There are 3 of them. The first stage doesn't show any symptoms. It's characterized by an increase of bile cholesterol level. Moreover, in such disorder, bile will contain less lecithin and bile acids, which are vital for the dissolving of the resulting stones. The second stage of the disease also doesn't show symptoms, but the properties of bile change even more actively. The stones begin to form, fill the person's gallbladder, and even enter the bile ducts. The third stage is calculus cholecystitis, and this is the stage in which the person runs headlong to the doctor, and if they want to dissolve the stones at this stage without surgery, then they must do a number of changes in lifestyle, use medications, and adhere to proper diet indicated by the doctor. What are the symptoms of gallstone disease? As we have already said, the first 2 stages of the disease usually don't show acute symptoms. The symptoms will appear under the following conditions: with inflammation of the gallbladder or its ducts, if there's a stagnation of bile, or when the gallbladder is completely filled with stones. Most often, the disease is manifested by colic. They are characterized by severe pain in the upper right part of the stomach or in the center under the ribs. Also, the patients may feel pain in the left hypochondrium, abdomen, back, under the right shoulder blade or in the area between the shoulder blades, increased sweating, pale skin, high blood pressure and tachycardia, vomiting, nausea, decrease in appetite, insomnia, and constant anxiety are also the side symptoms of this disease. If the body temperature rises and yellowness of the skin appears, then there's a high possibility of cholecystitis or cholangitis too. These diseases are caused by bile flow disorder. Diagnosis and types of gallstones. The 3 major types of gallstones. Cholesterol stones, usually yellow-green in color, consist primarily of hardened cholesterol. In the United States, more than 80% of gallstones are cholesterol stones. Pigment stones, dark in color, are made of bilirubin. Mixed cholesterol stones, accounting for the majority of stones found clinically, are composed predominantly of cholesterol, but also contain variable amounts of bilirubin and calcium salts. The treatment of the particular stones depends on their type, so it must be determined exactly. Here are the most common procedures that help find gallstones. An ultrasonic device called a transducer bounces safe, painless sound waves off organs to create an image of their structure. If gallstones are present, they will be visible in the image. Ultrasound is the most accurate method to detect gallstones. A computerized tomography scan is an X-ray picture of the body. A CT scan may include an injection of a special dye called contrast medium. CT scans use a combination of X-rays and computer technology to create 3-dimensional images. CT scans can show gallstones or complications, such as infection and blockage of the gallbladder or bile ducts. However, CT scans can miss the present gallstones. Cholecystography or hepatobiliary scan uses an unharmful radioactive material to produce pictures of the biliary system. In cholecystography, the person lies on an exam table, and the operator injects a small amount of unharmful radioactive material into a vein in the person's arm. Then a special camera takes pictures of the radioactive material as it moves through the biliary system. A specially trained technician performs the procedure in an outpatient center or hospital, and a radiologist interprets the images. Cholecystography is used to diagnose abnormal contractions of the gallbladder or obstruction of the bile ducts. Diet in gallstone disease. Gallstones are strongly related to high-fat, low-fiber diets. They are uncommon in Asian and African populations that follow traditional, largely plant-based diets, and they become more common with a shift toward westernized diets. A surplus of animal protein and animal fat, a lack of dietary fiber, and the consumption of fat from saturated rather than unsaturated sources appear to be the main nutritional risk factors for gallstone development. Changing your diet won't remove the gallstones that are already there, but eating a healthy, balanced variety of nutrients and limiting the amount of saturated fats and cholesterol-heavy foods may help ease your symptoms. Try to avoid or limit these high-fat foods in your diet. Fried foods, highly processed foods like donuts, pies, or cookies, whole milk dairy products, for example cheese, ice cream, and butter, fatty red meat. Also, avoid very low-calorie diets. If you're overweight, aim for a gradual weight loss of 1 to 2 pounds a week by sticking to a healthy, well-balanced diet and getting regular exercise. Always diet under your doctor's supervision. All of the following are healthy foods for your gallbladder as well as the rest of your body. Fresh fruits and vegetables, whole grains like whole wheat bread, brown rice, oats, bran cereal, lean meat, poultry and fish, low-fat dairy products. Certain foods have been studied for their potential to prevent gallbladder problems or reduce symptoms. For example, some research has indicated that drinking caffeinated coffee lowers the risk of gallstones in both men and women. Drinking moderate amounts of alcohol has also been linked to a reduced incidence of gallstones. In one study, women who ate at least one serving of peanuts a day had a 20% lower chance of having their gallbladder removed compared to women who rarely ate peanuts or peanut butter. Since alkalis do an excellent job of dissolving cholesterol, it's necessary to consume more alkaline full products like cheese, cottage cheese, vegetables with the exception of legumes, as well as various berries and fruits. Compared with infrequent consumption or abstinence, moderate alcohol intake was found to be inversely associated with the risk for gallstones. However, given the health risks associated with alcohol consumption, for example breast or colorectal cancer, caution regarding alcohol use is warranted. 7 signs that stones can be dissolved. In the gallbladder, there are only cholesterol deposits that can be seen on ultrasound and cannot be seen on X-rays. The stones are no more than 2 centimeters in diameter. Gallbladder functions properly and still produces bile. Stones occupy no more than 50% of the internal space of the gallbladder. The main bladder duct is free of stones. There are no calculi in the main duct. Stones appeared no more than 3 years ago, otherwise there would be too much salts accumulated on the walls, which do not dissolve. 10 signs that you shouldn't take medications to dissolve gallstones. There's acute inflammation in the walls of the bladder and in the main ducts. Stones in the bladder and ducts are more than 2 centimeters in size. The presence of any liver disease, diabetes mellitus, pancreatitis, stomach or intestinal ulcer, any bowel disease in the acute phase. If calcium carbonate stones can be seen on X-ray, if the gallbladder doesn't work effectively, if the woman is pregnant or breastfeeding. In any case, before starting the procedure for dissolving stones, you must consult with a specialist. What folk remedies dissolve gallstones? The use of folk remedies in the process of gallstones dissolving should only be carried out with the permission of your personal doctor. While medications and surgery are often used to resolve gallstone complaints, many people turn to natural remedies instead. Although there's no reliable evidence that these remedies work, the following treatments are popular organic alternatives to medical interventions. Lysimachia herba. Lysimachia herba or gold coin grass is a popular traditional Chinese remedy for gallstones. Research suggests it may be beneficial for treating or preventing cholesterol gallstones. Milk thistle. Milk thistle has been used medicinally to detoxify the liver for centuries. Dandelion. People usually drink dandelion teas or coffees to remove their gallstones. However, there's no evidence to suggest this is beneficial. Furthermore, people with gallstones, gallbladder problems, or kidney problems should speak with a doctor before consuming dandelion decoctions. Are there any other methods of dissolving stones? Yes, there are a number of non-drug methods that can help dissolve stones, but they can be used only after consulting an experienced surgeon or gastroenterologist who knows your situation well. One of the newest methods of treatment for gallstone disease is shockwave cholelithotripsy, which crushes gallbladder stones up to 3 centimeters in diameter into small elements. It may be used if the stones are cholesterol and the gallbladder performs its main functions properly. If you start eating fatty acids a few days before the procedure, the stones will be crushed in 19 out of 20 cases. Also, there's transcutaneous transhepatic cholelitholysis, an invasive procedure that is performed under general or local anesthesia. During the procedure, a special probe is inserted into the gallbladder through the skin and liver, and a special safe solution is infused that destroys the stones right inside the organ. This method dissolves stones in 95% of cases, but it has contraindications and requires a large number of tests. What are the most effective methods of gallstone disease prevention? If you don't want to face gallstone disease in your life, make sure to take the necessary preventive measures. By the way, all of them are also recommended for those who already have stones in the gallbladder. So here are 7 most important rules. Be on a healthy diet, don't overeat, and eat more vegetables and lean meat. Drink mineral water with sulfate ion more often. Visit health resorts at least once every 2 years. Give up smoking and drinking alcohol. Visit a doctor if you notice any symptoms of the disease in yourself. These simple tips will help you protect yourself and your gallbladder from diseases and surgeries. That's all we wanted to tell you today. On this channel, you will find videos about the benefits of different foods, about diseases and effective methods of their treatment, as well as interesting information about housekeeping and gardening. So make sure to subscribe to Big Progress and ring the bell. Click the like button under the video and share it with your family and friends. See you soon!